afternoon. It's once again 5:30. I'm going to take us back as opposed to moving us forward on a Friday afternoon. And of course, I am delighted, as I always am, to be here on a Friday at 5:30 to listen to you, the people. And then every once in a while, I'll stick in a little word or two. And, you know, every week is an interesting week in the good old United States of America. In spite of all the things that we hear and whatever else may be going on, we are still in a good country. And I wouldn't want to trade it for any other country that I know anything about. We've got our issues, we've got our problems, we've got our needs, we've got our hopes, we've got our aspirations, but I always look forward. We are talking today about health care, health services. And those of you who know me know that as far as I'm concerned, there is nothing in the world greater than trying to be healthy. You can have all of everything else that there is, but if your state of health is not good, is not what you want it to be, then you're missing something. And of course, we're right down the street from the Mile Square Health Center, which happens to be where I get my personal health care.
Oh, that's wonderful.
That's
great.
Where I come, and I've been there a lot this year. Yeah, I've been there a lot. But I've got an exciting guest who's going to talk health with us. Why don't you just go ahead and introduce yourself to my viewing audience?
I'd be happy to. Good evening, everyone. My name is Karen Brach. I am the president of Meridian Health Plan, a well care company. We are a large managed care organization serving Medicaid recipients, serving people who have dual eligibility with Medicare and Medicaid. We also have Medicare Advantage programs and healthcare marketplace programs in the state of Michigan, Illinois, and Indiana.
That's a lot. I mean, 3 of the great Midwestern states. But let me ask you, managed care. What is that really all about? I know years ago we talked about health maintenance organizations, the idea that we were going to have these systems put together that maintained health, that we were going to focus on trying to keep people well so that we could keep them out of the hospitals, we could keep them out of the emergency rooms, they could have a state of well-being. Managed care, that's an emerged term. What does it really mean?
So Meridian is one of the companies that the state of Illinois has contracted with to administer the health benefits for Medicaid recipients and those members that are Medicare and Medicaid eligible together. And what I like to think about when I think about what we do is care coordination. And so for those members who are patients who are Medicaid recipients and have special needs, usually very vulnerable populations or moms and children, we have a staff of care coordinators that help assist our members with accessing care. It can be very complicated to access the healthcare system. The very first thing we like to see is that members have selected a primary care physician. So like you, they have a medical home where they go to for the needs of themselves and their family members. And then for those members that have extensive healthcare needs, or catastrophic diagnoses, or are struggling with some of those things we call social determinants of health, we have staff that are there to help assist secure transportation to and from the doctor's office or pharmacy. They can help secure appointments with specialists and then help with what is one of the most important aspects of healthcare delivery, and that is when you're in a hospital setting or a nursing home setting and you're transitioning to home, making sure everything's set up so that when you get there, you can access all the services you need from your home and there's nothing missed. You have your prescriptions. If you have home health coming in, you've got a home health worker. And so care coordination really wraps around the delivery system of doctors and hospitals and patients to ensure that there are no gaps and all of the care is received.
Now, when we say that individuals are Medicaid, Medicare recipients, I guess if you're Medicare, it means you've reached a certain age, basically, and if you're Medicaid, it means that your income and socioeconomic status may be low enough to qualify.
That's correct.
And I can recall when the conventional wisdom suggested that people who were low income were too sick, too poor, and health status was such that they just wouldn't fit into these managed care, or too old. I mean, if they were, and people thought, 'cause I go way back to the 70s and late 60s in terms of health care development and the evolution of health thought in this country. I used to work at community health centers. I've served on the boards of hospitals. I've been engaged, and I used to run a health planning organization for about 15 years. And so people had this notion that you just weren't going to be able to fit low income or elderly people into these systems and that it would be too costly. Well, thought has obviously emerged a bit and changed. And if we're talking about health status, I'm saying where you look at the overall health of an area, of a community, and even of an individual. Basically, health providers are trying to get consumers to what point in terms of their individual or group health?
Well, again, as I think about the care coordination model, I would say that providers want their patients to be engaged in the delivery of health care, to be active in the decisions that they're making about their health care, and to be a part of the solution and the planning for what they might need. And that's especially important for people who have multiple diagnoses, multiple what we call comorbidities, or are
Sounds
various.
like me.
I hope not. But have both health issues, perhaps mental health or substance use disorder concerns, and then on top of that, have the socioeconomic struggles that you just mentioned. And so our care coordinators can help the provider and help the member navigate that system so that they're part of the care. But one of the most important things is that they establish a relationship with a primary care physician or clinic like you have. That provider will know all things about that patient and that patient's family, and then can help that person also make decisions that are in the best interest of their health care. And Meridian is one of the Medicaid managed care plans here in the state of Illinois, and we were recently acquired by WellCare. In the Illinois market, WellCare's brand is Harmony, and come January 1st, we'll be one company, and so our company will be called Meridian, a WellCare company.
And you will be servicing with the combination, the combined.
Correct. A little
How
over,
many?
About 800,000 members estimated. There's over 2 million recipients in Illinois today that are on Medicaid.
You know, I feel guilty when my primary care physician has made recommendations, and if I have not followed it, I kind of feel like a kid who got caught in the candidate
Me too.
job. You know what I'm saying?
Yes.
And so, especially when it's time for a visit, then I try to get on my P's and Q's. But these tests and things that they can give can determine what you've been doing long range.
Well, and that's a great point. So one of the things that we help to do is to remind people of when it's important to have those tests. And so we are measured on quality performance. And so the one of the benefits of the system that the state of the Medicaid program offers is when people call to our call centers to talk to us, we actually have a screen that pops up that says, your little boy is due for his well child visit, or you haven't had your colonoscopy, or when was your last mammogram? We have no record of that. And so we can help remind people of those critical due dates for those tests that you were talking about. And in addition, once they have them, we can recognize that and say, thank you for getting your mammogram. This is what you needed to do, and we'll send you a reminder in 12 months or whatever.
And if we're doing that, then in an overall sense, when we talk about the high cost of health care delivery, all of these things will combine to help keep the cost down or reduce healthcare costs to the extent that people can have a relatively good state of health, and it's not costing us more than we can afford to pay.
Agreed. The cost benefits really follow the quality initiatives. So if you're doing these things up front, if you have a primary care physician, if you're getting all of your well visit exams and testing, you're absolutely right that the cost curve does change.
I ran into the person who used to run the Medicaid program for the state of Illinois today at a luncheon that didn't have anything to do with health. It had to do with foreign policy and other things. But her name is Julie Hamos.
One of my favorite people.
Yeah, and Julie and I had a little conversation. You know, she's been in state government, and she sort of indicated that she may go back to doing some work. And I said, well, I would be delighted if that was to happen, because I find that many of the individuals who are professionals in the healthcare business, why don't I go and take a call? My caller has been trying to get in, so let me take this call. Caller, are you there?
Yeah, how you doing, Connie? Dave to your guest. Okay, when she was talking about the health care, and I heard some people talking about they're going to close it down. What if the people who's going to try to close it down, what if God trying to close them down?
You're talking about something that the President of the United States has mentioned lately, closing down the government.
Yeah, okay. What if when he come out, he's going to try to close the government down, Again,
well, we would hope that he would not do that, because the government helps in many instances to pay the bills for some of these things. Medicaid and Medicare, even if you have states handling some of the cost, but much of the cost is really paid by the federal government. And so I'm going to hope we do have to go back to Washington on Wednesday, and hopefully we will have something on the table that we can just vote on and say at least keep the government running, and then get on out of Dodge and come back home so that I can make it to my Christmas party. I better mention it. Our annual Christmas party is actually Thursday, December the 20th. And of course, everybody is invited. And everything, of course, is costly. Nothing to you who come, everything is free. As we always do, and we've done this party now for more than 20 years. And so we look forward to people coming. It's going to be at 500 South Central, right across the street from Loretta Hospital. So you can't miss it. It's the Columbus Park Field House. Starts at 6 o'clock. All the food you can possibly want. Great entertainment, program, Christmas party, just everything.
Congressman Davis.
Yes, sir.
Okay, when he talk about he gonna close the government down, God is going after him and some of his people though. Because God got the last word, Congressman Davis. Y'all have a good evening.
Well, it really takes all three entities working together. And if you can't get agreement from all three of them, you don't have a law. And so, the president could shut it down if we don't reach agreement with the House, the Senate, and the president all saying, let's keep this going. So hopefully we'll get enough agreement to do that. Thank you so much, James, and let's take this other call.
Yes, Congressman, and first of all, I want to say it's a great day to be on God's green earth.
Yes.
I like to wish all the regular listeners and to your guests happy holiday to you, sweetheart, and your family.
And to you.
And
Thank you.
all the regulars that listen to this man's show. Normally this show be popping. And I like to wish all of them, Paul, all of y'all guys, a safe and a wonderful holiday to y'all's family. Now, James, I hope you're still listening because I'm going to go a little deeper with the duck. What I like to ask this, Donald Duck have been threatening in the past that he will fool around and tamper a little with Medicare and Medicaid and food stamps. So what is that, the FDA or something like that, I think. But anyway, what I want to know is this. Technically, he can, but I'm assuming he can't pass that bill to do that. But what will happen if he do cut back? I'm assuming, and this is to your guest, Congressman, will some of the services that was issued will maybe be cut back, or how would that work?
I think I can let my guest answer that without putting her on the spot. So
Yeah, but
I don't consider that
you answered in the political way.
Yeah, but no, I think she can answer that.
All right, let me get out the air and hear your response, and thanks for taking the call.
All right, thank you.
Thank you, and Merry Christmas to you and your family as well. So it's difficult to anticipate what might or might not happen at this point in time. I can tell you in the state of Illinois today, there are no plans to change the benefits that are going to be effective or today and then effective 1/1. Should there be changes to the program, there is an extensive process to go through with the federal government to amend the benefit plans or designs that the state has come up with. So at this point in time, it would be difficult for me to speculate on that. But today, there have been no changes to the program that will be up for open enrollment now and through January and March.
I would hope that we don't have to go down that road of trying to prevent. I mean, we've come a long way in terms of health care in this country. I went to 3 funerals last Saturday, and all the people were in their 80s or 90s. I went to one event where fellow Tim Black was 100 years old.
Wow.
And had a party, a big party last Sunday. So he was 102 days.
Wow.
And the week before, I had gone to Miss Assamay Stanabacks. She used to be on the board of Mile Square. She was 101. And she had been doing, I went to her 100th birthday party, and she was singing and dancing and doing all that. So quality of life has been improving, and I want to see that keep going. And as long as we have good health care providers able to provide the services, I think we'll see it. We got another caller. We'll take your call. Caller, are you there?
Yes, how you doing, Congressman?
Good.
I might want to change the subject a bit. I want to comment on prevention. I have a doctor I've been going to for 15 years, and he gave me a lot of education on prevention. He sent me to a pre-diabetes class, a lot of things you would think would not cause diabetes, like too many fruits and too many grapes, and he also sent me to exercise, and he would not give me antibiotics. He try across-the-counter medication before you get antibiotics. I think we should focus on eating, try to eat the right food, try to exercise, less stress, and prevention before we get into bad health. And I'm 76 years. I'll be 77 January the 7th. And I'm trying to get to be old as I can.
Well, let me ask our guest, what does Meridian advocate those kind of things?
We absolutely do. We have programs that help to support nutrition for some of our members that would qualify for a weight loss program. We would cover those. So we absolutely advocate for prevention and the importance of establishing a relationship with a physician. If you need some additional help on nutrition, especially if you're a diabetic or pre-diabetic, it sounds like you have a wonderful physician who is helping you to manage that so it didn't become full-blown diabetes. That's exactly what we want you to focus on. And I mentioned those quality programs earlier. Those are the types of programs that we, or types of outreach that we do to help people monitor their health. So if they are entering a time where perhaps their blood sugars are too high and they're trending towards diabetes, we can work with them and their physician to find the right program. So that's exactly what your managed care organization, your health plan will help you do. And I commend you for following direction and for taking your own health into your own hands. That's amazing.
Well, Mary, let me thank you and let me agree with you, because I believe that an ounce of prevention is worth much more than a pound of cure. And so if we can prevent some of these things from happening, then that's going to not only make you feel better, but it's also going to save money. So you're right on the money. Thank you so much, and I agree with you 100%.
Okay.
Thank you. Let's see if we got another call. Did we have another caller? All right. Well, we got to wrap up anyway. So why don't you just reiterate some of the important features of Meridian and why you're so important?
So again, Meridian was recently purchased by WellCare, and we are now a combined entity between Harmony and Meridian. We are one of the managed care organizations that Medicaid recipients and dual eligibles, people with Medicare and Medicaid, can select to help them manage their health care. We are throughout the state. When the state expanded the contract, we are now statewide in the state of Illinois. Effective January 1st, any Harmony member that was originally enrolled in Harmony will be enrolled with Meridian, and they will be receiving their member ID cards, their handbooks. Any additional information with regard to the Meridian health plan will be mailed out to any of the Harmony members that were assigned to Meridian. This is a really important time for Medicaid recipients because it is open enrollment. So for everyone who enrolled in Medicaid as of January 1st, will be open for open enrollment now, or up for open enrollment now. I strongly encourage people to open their mail. It's very important if you're in the process of being redetermined for your eligibility for Medicaid. You open your mail, you complete the forms that you need to, or go online at HFS's website to sign up for or re-enroll in your Medicaid benefits. and please make a selection of your primary care physician and your health plan. If you're already enrolled in a health plan and you don't want to change your health plan, that's fine. You don't have to. You don't have to do anything. But if you want to make a selection, or if you're new to Medicaid and you need to make a selection, you need to open up that mail.
Well, our time is about up, but it's really been a very informative afternoon. I want to thank all of our callers, all of our viewers, and all of us who've shared in this very important information. I always say that not only do our viewers have a lot of opinions, but they also have a lot of knowledge, a lot of information. They really get it. They really understand it. And I think these plans are super valuable. And so we're pleased. And remember, Thursday, December 20th, everybody is invited to our annual Christmas party. And we won't let you eat more of that potato pie than what's good for you. And so we'll help you watch your diet and watch what you eat. But have a wonderful weekend. We'll see you next week. And I look forward to our next session, because we'll be talking about the Christmas story and the night before and all through the house and all of those things. Have a good week. We'll see you next Friday.